Welcome to this body scan practice. The body scan is an opportunity to reacquaint oneself with the experience of being a human in a body. The goal is not to change anything about the body, but perhaps to relate to the body in a different way, to have a different experience of the body. Again, all of the guidance offered in the introduction is relevant here, particularly about any part of the body that might be feeling pain or discomfort. If that is the case, feel free to attend to a different part of the body and tune out the words that I am speaking and return only when you feel ready. The body scan can be conducted in a number of postures, most frequently lying down on the floor, on a mat, on a bed. You could engage in this practice seated upright in a chair. You could sit on a cushion, a bench. You could even do the body scan practice standing or walking. The goal is simply to allow the spotlight of your attention to shine on whatever part of the body being addressed, not needing to think of, move, or imagine that part of the body, but simply to experience that part of the body exactly as it is, right here, right now, in this present moment. And so we'll begin by coming to an awareness of the entire body here in this space, in this place, in this moment. Maybe sitting, experiencing the weight of gravity on the whole body. Maybe a sense of where the body meets the edges of space, the boundaries and peripheries of the body. Maybe coming to an awareness of the feet on the floor, however they might be making contact. The seat, the back, the shoulders, the arms, coming to an awareness of the orientation of the head in space, not allowing the head to drop or to bend or to crane backwards or upwards, but trying to find a sort of neutral posture for the head if you're sitting upright, or allowing the head to rest fully on the support beneath it. And if the body is lying down, experiencing all the points of contact where the body meets the support beneath it. Maybe that's the heels or the buttocks, the broadness of the back, the elbows, the hands, the wrists, the shoulders. And in taking in this whole sense of the whole body, coming to an awareness of the breath in the body, maybe as if a spotlight was shining on the breath in the body, perhaps on the belly or the chest, rising and falling. If it's hard to capture the experience of the breath, maybe taking an intentionally longer, deeper, more forceful breath in and allowing the exhale to be a bit more forceful, just slightly, just to come to an awareness of what the breath might feel like. Otherwise, no need to change the way that you're breathing. And in settling into this posture, allowing that spotlight to shift from the breath in the whole body to the feet. Left foot, right foot. Taking in the experience of the feet, the experience of the heels, the soles of the feet and the toes, the big toe and the little toe, and each toe between. Maybe noting the experience of socks or shoes, or if you're barefoot, seeing what that experience might be like. Is there anything notable about the feet? A sensation of warmth or coolness? Dryness or moisture? Is there a sense of balance and symmetry here, or is one foot more available to your awareness than the other? Is there some discernible difference between the left foot or the right foot? Just resting in awareness of feet. And if any other part of the body comes to the forefront of your attention, just acknowledging it and then turning the attention back to the feet. There's nowhere else to go and nothing else to do. There's no other job right now except to pay attention to the feet. And passing the attention up from the feet to the legs. The length of the shin and the space between the ankle and the knee. Maybe sensing something bony here. Passing the attention up from the knees to the hips, taking in the experience of the thighs. Maybe some sense of fullness or heaviness. Some awareness of the body at the level of skin, right at the surface maybe, the clothing on the body, the outermost layer of the body's contact with whatever might be enclosing it or around it. Or maybe deeper, the level of musculature, tendons, or even deeper than that at the level of bone, the very structure and foundation of this body. Bringing the attention up from the hips to the whole pelvic bowl and the lower part of the abdomen. Sensing all of the organs here, organs of digestion and elimination, reproduction and sexuality. Again, noting whatever might be available here with kindness and care, patience and persistence. Maybe there's some gurgling or sense of vibration or movement in this part of the body as the breath comes in and moves the abdomen. And passing the attention up from this lower part of the torso to the middle and upper part of the torso, the stomach, the rib cage, the chest, along with the reverse side of the torso, the back, the lower, middle, and upper back. Maybe sensing pressure here, the point of contact with the chair behind you or the floor below you. Sensing up into the sides of the torso, under the arms. Sensing the front of the torso and the lower part of the neck, chest, rising and falling, breast tissue here, maybe even deeper. The sensation of the heart, the breathing of the lungs, an expansion or contraction of the rib cage. What is notable here in this torso, in this moment? Passing the attention from the torso down to the very tips of the fingers of both hands, right hand and left hand. Hands at rest, maybe at the thighs or at the body's side, or resting on the lap. All these tiny capillaries and nerve endings at this part of the body can make the hands quite interesting to attend to. Hands at rest, not doing anything, not grabbing, touching, writing. Just still hands. What can be sensed here in the little finger and the thumb and each finger in between? Is there a sense of the spaces between the fingers, the palms of the hands and the backs of the hands? Is there a sense of the wrists, wrapping the attention around each wrist, and noting the space between the wrist and the elbow, the bony protrusion in the middle of the arm, the whole length of the forearm on each side, and passing the attention up from the elbow to the shoulders, noting experiences in the biceps and triceps. Is there tension or holding here? Are the shoulders rolled forward or backward? And although nothing needs to change, this might be an opportunity to just once again check in with the posture. If drowsiness or sleepiness has shown up, maybe the posture can be checked in on here. Allowing the shoulders to come back and down if they're rolled forward or hunching in any kind of way. And passing the attention up from the shoulders to the neck and the throat, and taking in the head, the whole head, the sides of the head where the ears are, the back of the head, the top of the head, and then all the way down the front of the head to this face. And if the eyes are closed, maybe sensing the closed eyes in their sockets. Eyes at rest, not moving, not doing anything. The bridge of the nose and the nostrils, the cheeks, the lips, the chin and the jaw. Sensing into the mouth and inside of the head, the tongue, the teeth, the gums, maybe moisture here, a sense of temperature. What can be found in this experience? And what can be found in the experience of the whole head, again, passing the attention back the way that we came, from the face to the top of the head and the sides of the head and the neck. Passing the attention down from there to the shoulders and the arms and the hands. Attending to the area under the arms and the torso, the chest, the back, the belly, the pelvis and the hips, the thighs, the knees, the lower part of the legs, the ankles and the feet. Taking in this whole body, from the tips of the toes to the top of the head now, just an awareness of this whole body, and maybe returning to an awareness of the breath, and as you breathe in, almost imagining that the breath extended to every little part of the body, and as you breathe out, imagining that the breath exhales from each part of the body out again. And if you like, choosing to rest here a little bit longer in awareness of the whole body, or returning once again to any particular part of the body that you might like to attend to, or scanning up and down, back and forth, once more at your own pace.